Good evening, everyone. I am Dr. Soundarya, consultant at Preeti Urology Hospital, Hyderabad. We are presenting the settings of Thulium fiber laser. There is no conflict of interest. In India, the IPG Photonics produces Thulium fiber laser machine, and we are using the 60-watt machine, that is Urolace SP, in our institute for the past 2 years. With our 2 years of experience, whatever the learning we have acquired, we are suggesting settings for various endourologic procedures. The modes of operation available in this machine are: one for the lithotripsy and the second is for soft tissue. In the lithotripsy mode, the combinations are dusting and popcorning, fragmentation and popcorning, fragmentation and dusting. In the soft tissue mode, the incision, hemostasis, and vaporization modes are available. Coming to the dusting mode, the first setting is 60 Hz, 0.1 joules, with which nice painting could be done. In a case of large volume hard stone, this fine dust is produced, but one disadvantage is it is a little slow and we cannot appreciate the quality of dust which is produced while we are doing painting. The second is fragmentation mode with 10 Hz and 1 joule. This is a magic number to remember. This produces very fine dust and we could do this kind of chipping just like the way we do with holmium yard laser. And the third setting is 15 Hz, 2 joules, fragmentation mode. This is used for breaking the stone into pieces, that is larger fragments are produced. The fourth setting is popcorning with 0.2 joules, 275 Hz. This 0.2 joule energy helps to do popcorn and this kind of fine dust is produced with large volume of fragments. Thus, there are some special situations where this fragmentation mode is useful. It's very unique, 15 Hz and 2 joules for cases where we cannot do painting for a long time, like where the scope is in abnormally angulated position. Just for example, like horseshoe kidney, or this on the left side is the obese patient with ptotic kidney with abnormal angulation of scope, where we cannot do painting for a long time. This kind of fragmentation setting can be used. We make the stone into pieces faster, followed by popcorning. This is a case of diverticular stone, where with the soft tissue mode incision, same 10-1, we are incising the tissue which is covering the buried stone. After that, the settings should be changed to lithotripsy mode to complete the laser lithotripsy. This is a case of large bladder stone. Here we have increased the energy up to 6 joules and 9.2 Hz in fragmentation mode. Larger size fiber is used, 550 micron fiber, and this produces effect just like pneumatic lithotripsy. The only problem is the fiber burn back is more because of the higher energy. Next is the soft tissue application. Here we have incision and hemostasis modes. The foot switch on the right side comes for hemostasis and the left side is for incision. This is a case of bladder tumor where we are doing en bloc resection with the same setting, that is 10-1 incision mode. The right plane could be achieved in a distended bladder with minimal bleeding. Next is posterurethral valve fulguration. Same setting could be used. This is a 4 months male baby. The same setting, 10-1 magic number. Next is en bloc enucleation of prostate. Here the settings are slightly different, that is 1.5 joules and 33 Hz. Because of the larger volume of tissue, a little bit higher energy is required. 1.5 joules and 33 hertz. Now for hemostasis, the maximum average power is 30 watts, and here this is a case of bladder tumor again, where we are using 0.5 joules and 200 hertz, that is 30 watts power, for effective coagulation of the blood vessels around the tumor. So this is in a nutshell for various endourologic procedures. Dusting 60.1, fragmentation 10.1 for dusting, fragmentation 15.2 for fragmentation, that is pieces. The fourth one is popcorning 275 hertz 0.2 joule. Fifth, the incision mode 10.1. Lastly, hemostasis 200 hertz 0.15 joules. Thank you.